Today is Friday. We made it another week. I'm really excited to give you a new update, very important update. There's been a new symptom that has been discovered um, correlating to coronavirus positive patients. This symptom is loss of smell. Medical term for this is anosmia, noticed by medical professionals with a large number of coronavirus positive patients. So they're reporting loss of smell, sense of smell, few days before a fever or few days before other symptoms come on, or sometimes some patients experiencing loss of sense of smell and no other symptoms. This symptoms is being reported more and more throughout medical field. So I want to communicate that to you, and please be aware of your sense of smell. That means you have to get a little bit more in touch with your body, more in touch with your awareness. Check your sense of smell on a daily basis. Make sure that you still have it. And if you lose it, please be really concerned. So just to make it clear, you can have no symptoms at all, and if you losing your sense of smell, that could be an indicator that you're coronavirus positive. Another kind of a pattern in symptoms, we're noticing feeling worse. So you get onset of fever, 101, 100 or so range. And then in few days or maybe in one day, fever goes down and you start feeling better and you think, oh, this is kind of maybe something else. And for a few days, you have no symptoms. Symptoms are kind of go down. Then all of a sudden, fever comes back and you start feeling worse and worse and worse. And that cycle may repeat itself on and off, on and off. This is also correlating to coronavirus, just FYI. Right now, our emergency room physicians recommending Tylenol for your fever management and not ibuprofen. So another big topic that I wanted to talk to you today is hygiene. Tips on hygiene. So there has been few articles on benefits of washing your nasal cavity with warm water, soapy and salty solution to keep it clean. And I'm gonna talk about NetiPot technique, and most of you probably heard it. NetiPot, I have the pot right here. So basically what it is washing your nasal cavity by pouring water in like so, and then switching to another nostril, and then pouring water into the other nostril, and then the water comes out of your other nostril right into the sink. So you obviously have to do that in the bathroom. So let's talk about why. When we wash our hands with soap, the molecule of virus looks kind of like this, like you've seen it on TV with spikes. So why soap? I mean, most of the time it does not kill the molecule itself. What happens is the soap is slippery, it's really slidey. The molecules of virus have really hard time sticking onto the surface with their little spikes like this, because you're putting soap in and they become slippery and they just wash away. So by keeping your nasal cavity clean, you are minimizing that risk. If you go out for grocery shop, or you have to go to work, or you really had to go to that meeting, it's an emergency, or you care for someone at home and you're entering their environment, after you get out, use your NetiPot to clean your cavity with warm soapy water and salt. So take a little bit of salt, a little bit of soap, mix it with warm water, and then your solution is ready. When they recommend to drink warm water, it washes all the particles of virus and other germs into your stomach, and the stomach acids obviously kill the bacteria and the virus particles. Some people have really hard time with this process, with putting water in your nose. It's extremely difficult for them, and they're not willing to do that. And that's okay. For people like that, I recommend nasal swabbing. Also, there were several articles about it by physicians. So you take regular soap, you take a swab, you just like a Q-tip, a regular Q-tip, and you do this in the bathroom. So you're making it wet a little bit, make it wet, put some soap right on the Q-tip, and then by putting it inside of your nose, just like inside on the wall, and as deep as you can without being uncomfortable, just coat that soap into your nose cavity. It's gonna automatically mix with your moisture in your nose and backwash into your throat directly into your stomach. So when you have particles of soap in your nasal cavity, it helps the circulation of moisture. So the virus got in there fresh. It has no chance to kind of embedded itself in that nasal environment. It circulates into your stomach, and then your stomach kills it. Think about these techniques. Also, deriving from these patterns of thinking like that, please empty your nose often. So when you come back from somewhere that you think was dangerous environment, go ahead and clean your nose. Go ahead and empty your nose, and then maybe swab it, maybe clean it with this NetiPot, and that's gonna minimize your risk for contracting. Another hygiene tip is cutting your nails and keeping those nails short almost every other day. Don't let them be really, really long. Your nails collect a lot of different samples of environment normally. And also when you wash your hands and when you sanitize them, if you have long nails, it's very hard for a solution to get underneath there. So those humans who have long nails and who have fake nails, please consider taking them off for right now. I know it's hard. I know it's it's really beautiful, but if you have fake nails right now, long nails, please remove them and keep your nails short. This is also minimizing your risk of contracting coronavirus right now. So those are the news for today. Please stay calm and please stay smart. Keep educating yourself through articles that based on science, articles that are not emotionally make you crazy. Please learn how to filter all this information into educational information where you could make smart decisions. Also, please be aware of your state of fear. Assess yourself every day on your state of fear from 0 to 10. Anxiety, anxiousness, confusion, all those signs are signs of fear. Also talk with your kids about it, assess them, see how their mental state as well. They're not showing problems like adults do. So keep your kids in the loop of what's going on. They're going to have to also puzzle this problem. They're gonna grow up to be, a scientists and fighters. They're going to help us to figure out solutions for these new threats. Keep up your positive mental attitude. Keep up centering yourself. Keep up with allowing your senses to come to you and listening to your body. You see, when the sense of smell symptom is really important, because a lot of people out there, they're not even noticing their sense of smell. That symptom can be unnoticed. If you feeling anxious and you in a state of constant fear, you're not noticing what is going on in your body, and you may not notice the symptom of smell loss right away, which you really need to. So please be aware of your own senses. That means centering yourself. Don't use a lot of alcohol. Don't use a lot of pot smoking right now. These things contributing to weakening your immune system. You need to keep your immune system up, and then you need to keep your conscious thinking up. And if you use alcohol and smoke weed a lot, those senses are dulled and you're not actually able to assess yourself. So if you want to have a glass of, half a glass of wine or a glass of wine before dinner, that's okay. That's different than every night you're drinking 2 or 3 glasses of wine or taking shots to help you feel better and fall asleep because it's crazy out there. But that takes your immune system down, and also that takes your awareness down, so you can't assess yourself. So that's really, really important right now. Stay focused. Thank you very much. Be strong, Seattle family. Namaste.